Are you ready to break free from the doubts and limits holding you back? Welcome to Embrace Your Value, where therapy meets coaching to help you unlock your true worth and take control of your life.
Hi, I'm Kristen, a trauma therapist dedicated to helping you heal, break old patterns, and reclaim your power.
And I'm Jen, your support coach, here to show you how to set fierce boundaries, embrace self compassion, and step boldly into the life you deserve.
So, whether you're stuck in self doubt or feeling lost, know this: your value isn't up for negotiation. It's time to own it.
Every week, we tackle real issues that challenge, inspire, and empower you to live with purpose and confidence.
So, grab your favorite drink, take a deep breath, and let's get started.
Because you're not here to play small, it's time to embrace your value. Welcome back to the podcast. We are coming in today with a very special episode. I have asked Kristen if she will help us look at like different ways and different things that need to be diagnosed on the therapy side and what those look like. And then we're going to spend a little bit of time talking about PTSD and what that really looks like. So, Kristen, I'm going to kind of let you start and tell us just the real basics on how people know if they even need to go to therapy. Like, how do they know? What kinds of things come up?
Yeah, thanks, Jen. Well, I'll answer your last question first, which is, do I need to go to therapy? And the answer is, if your symptoms persist, so if we're talking about sadness or we're talking about anxiety or worry or fear, if they persist longer than, maybe 3 days to 2 weeks to, sometimes it's months for people, that's when it's probably a good time to, and you've exhausted your resources, right? We've talked to friends, we talked to family, but we're still feeling these symptoms. That may be a good time to go to therapy. So I think that's the short answer for that. So the way we diagnose, there's a very specific set of criteria. Like, it's not this willy-nilly thing, right? So someone comes in, we take a history, right? Like a pretty good detailed history of like, why are you here today? What's happened in your past? And then like, what are your symptoms? Like, what's been going on? Maybe people are not sleeping. Maybe they can't work because they're worried too much, or maybe they're stuck in their house because they don't even want to get out. So there's a lot of things that we look at to sort of diagnose the different things that people tend to be struggling with. And so it's literally like a specific set of criteria that gets met. So what we use in the mental health world is called the DSM-5, and you can see it's a big book. And so every mental health diagnosis that is covered by insurance, we'll just say it that way, is in the book. So I would say, being a trauma specialist, obviously what I see most is trauma. And so I think there's a lot of misconceptions about what trauma actually looks like in the setting of therapy, right? So any questions on, I don't want to be too technical. So Jen, as a layperson, as a coach, do you have any questions on like how I described how we diagnose?
Um, no, but I do have my own knowledge around some of that because I have taken some different psychology courses um in my own studies. No, I mean maybe going into a few more of like what some of the symptoms are that would maybe bring somebody into therapy. I feel like sometimes when we're in the middle of it, we don't notice how bad it really could be. So it might even be like you noticing something in someone else. Like I'm going to go back. We talked about this with the seasonal affect depression, but like I noticed last year with my mom, who I'm very close with, I noticed I wasn't hearing from her as much. I noticed I wasn't, when I talked to her, she wasn't as peppy. She didn't have as much excitement in her voice. She just always seemed a little sad. And so one day I finally said to her, "Hey mom, are you okay?" I didn't bring it up right away. I gave it some time. I let it go. But then I was like, "Are you okay?" And she was like, "Well, I just can't get out of this funk." And I said, "Yeah." And I pretty much knew that's what she was dealing with. And so, because it was like sub-zero degrees for like 3.5 weeks and we had zero sun, and she couldn't get out of her apartment. So, those might be the things like to me that I think um, maybe we want to know about. Like, what kinds of things do you look for in clients, or that the clients come to you often with, "I have this going on," or "I have that going on"?
Yeah. So, I mean, honestly, I could do a segment on each one of the most common diagnoses that come into my office. But I would say literally top three are going to be anxiety, like some sort of anxiety disorder, trauma, and some sort of depressive disorder. So when we look at anxiety, it is sort of that constant worry. So there's a spectrum, right? Like it can go from I've got a lot on my mind, I can't seem to focus. Like that's one of the common symptoms. Maybe people get into a freeze because they get an overload of what's going on, and then we go into fight or flight, which is something we've talked about before. So that's an anxiety is more of like a worry. The way I describe it is I feel like anxiety typically presents as I'm worried about right now or the future. And depression tends to be I'm feeling low right now, mostly because of something that's happened in the past, right? That continues to bother me. So I would love to do like a longer segment on each one of those, but I would say your description of what your mom was going through and what you noticed is a pretty good description of how people present with depression, right? So it's I can't get out of my house, I can't do the things that I normally want to do. Um, you know, any of those type of like just sadness, just like maybe I'm sleeping more than usual. Those kinds of things are like typically is gonna like be my oh, okay, maybe this is depression. I'm gonna ask more questions, right? So that's like super baseline. And then anxiety is when people are saying, like, I have decision fatigue. I can't keep my brain straight. I get fuzzy. Like that's a big one that happens with anxiety, and that's to our due to our brain's inability to process all the information that's coming in because we're in this overload. And that's also a symptom that a lot of people with ADHD will struggle with, is that so much is coming at them that someone without ADHD has a hard time understanding, because we can process things individually, where someone with ADHD, it tends to come at them all at once. So I would say that's similar to anxiety, where you're unable to filter, right, what's coming at you. And so it feels like everything's happening at one time. So I would love to go more in depth into either one of those, because I do think, like I said, three most common: anxiety, depression, trauma. Here's the thing, they're all linked, right? So people who struggle with what we call generalized anxiety disorder, which means it's sort of this undercurrent of anxiety that you sort of just live with, right? And you maybe have learned how to function, but it affects your day to day. Okay. So that's one of the technical diagnoses that's in the DSM. The other one is major depressive disorder. Similar thing, it's that low feeling over a long period of time that isn't attributable to like a death or a loss of a job or something like that. We categorize that under grief. So there's a distinction between grief and depression. Now, one can lead to the other, and so there's all these ways to take a look at it. It's kind of complex, and that's why we do a detailed history, and that's why we ask more questions when we start to see like what are the symptoms that you're presenting and that you've historically had, and how can I put these together so that I can figure out where we are. Because if somebody's depressed and it's just like I've been depressed for like 2 months, then okay, we probably don't need medication. We can just kind of work through that. If somebody's been depressed for 4 years and they haven't dealt with it, maybe medication is something that we need to jumpstart the process so that we can, get through the work that we need to get through. And then maybe you can get off the medication. There's a misconception that once you get on it, you have to stay on it forever. And that's not necessarily true. If you have major depressive disorder and it has been a lifetime thing, you are likely to need that medication over a longer period of time. So,
I have a quick
um,
question. I want to intercede.
sure,
Sorry,
sure.
this hit me as you were talking, and this might be really inappropriate. So forgive me if it is. And if you don't want to answer, you don't have to. Um, why is it that when we go to the doctor now and they start out with, are you depressed? And they do all of that and say you answer yes, and they, at least in my experience and the people I've talked to, they don't tell you to go see a therapist or a counselor or anybody. They go, well, let's just put you on a medication. And I have my own thoughts around that, but I'm curious if you have thoughts around that. And I don't want to cause like some sort of stink or uproar, but I just feel like that's something that, wouldn't it be great if even for coaches, even like if doctors could work closer with therapists and coaches and people in the mental health industry and do more of like a referral basis thing and versus let's just put you on the medication. Sorry, that kind of hit me as you were talking and I was like, oh, this might be a good segue in here.
Yeah, and I would say that's actually a fantastic question. So I do try to partner with doctors, like my own personal doctor. We refer back and forth because she understands the value of therapy. And so, what I'll say before I answer your question in full is that medication is 4 times more likely to be effective if you're in therapy in tandem with the medication. So, I think that's something that doctors don't necessarily inform people of. Primary care physician, then right, their job is sort of general. And so what I encourage people to do is if your doctor has recommended a medication, because what doctors do is they'll kind of give the basic low level, here's what everybody can kind of take medication and let's see how it goes. So we're kind of like shotgunning, right? Let's see if this helps out. And then if it doesn't, we'll figure out the next thing. So I think you're right. I think that if doctors see these sort of depressive symptoms, and I will say, like when I took my son to the doctor last week, they actually had him fill out there's two different types of questionnaires that you can like it's just simple questions and like the 0 to 5 kind of answer that can determine if you're inclined towards depression or anxiety. So that's good. Like, right, doctors never even used to ask unless you brought it up. So I think that's a huge step forward in the medical field, in the Western medical field, to start asking these questions. So I think they shotgun with a because people want like a quick relief. Like they want relief really quickly. Sometimes it's hard to get into a therapist. And, medication works in the short term and may make you feel better for a little bit. And so we're not overwhelmed. So I would say I'm not a doctor, but in my experience, I think that's probably why they they will start with medication, but I'm down totally with you about, hey, let's also go see a therapist. Let's give the information that therapy in conjunction with medication makes the medication work better. Right. So does that answer your question?
Yeah, absolutely. Because I find it to be very frustrating. I mean, I know for me, even for my own health, when I went to the doctor and I was like, hey, I want to try these supplements, and I showed them the list of ingredients, all the doctor said to me is, well, there's nothing in here that will hurt you. It wasn't like, hey, good for you for taking a proactive step. Good for you for trying to do the right thing. Like maybe you should do this and this. Or, I know they don't always know because they are GPs for the most part. And so they don't always have all those answers. But I feel like we would do better in this country if we spent more resources on trying to partner the right people together versus just throwing, like, I went on supplements so I didn't have to go on a prescription. I don't want that synthetic, that chemical in my body. And, there was no, well, good job for doing that and really protecting yourself. It was like, well, if it doesn't work, we're going to put you on this anyway. And thankfully it did work. But yeah. So that's kind of where I got a little beef with a little bit of it. That's just kind of my thing. But anyways, yes, I think that's great. And I think that's helpful for somebody, especially if we have listeners out there that don't really know about any of this. Like this is all new for them. Like this is why we're doing this. This is what we want you to get out of it. So no, that's great. Thank you, Kristen, for sharing that. And I'll let you continue on with your brilliance and beauty.
Thank you, Jen. So kind of back to PTSD, which in my opinion is the basis for most of these diagnoses that come out later in life, including anxiety, including depression. I mean, there are chemical factors to those things, which is why the medication tends to be thrown, right? OCD, there's a lot of things that substance abuse, that's my big one. That's another specialty I have is substance abuse and resolving that. I have never found anyone who has a substance abuse diagnosis that didn't have trauma in their background. So, and that's a whole nother segment too, right? And I know you and I can both talk about that one. And we've dabbled in it here and there with some other episodes, but so I feel like everything is sort of rooted in trauma, which I feel like is why that's the best thing for us to get out first is for people to go, do I have trauma? Is this considered trauma? Um, and and then how do I get help? How do I move forward? So PTSD, post-traumatic stress disorder. So if we break it down to its simplest parts, right? Post being after, traumatic being something that happened to you that created trauma, that then creates a stressor, which we respond to with anxiety, with depression, with OCD, with whatever. And then disorder, right? Like it means the set of criteria. That's all disorder really ever means, right? So a PTSD diagnosis is made when someone experiences specific symptoms, of which I will talk about in a moment, following a traumatic event that involved actual or threatened. So this is important to be like actual or threatened. So obviously an actual threat is something that has happened to you physically, right? Or mentally. So those are the two. And then threatened is you thought this thing was going to happen to you. And so it results in the same sort of symptoms that the actual threat does. So an easy way to describe it might be actually getting into a car accident versus avoiding a severe car accident, right? So that's kind of I mean, there's still, we all have that, and that's a pretty simplistic answer, but just to kind of give people an idea. So actual or threatened death, serious injury, or violence. The symptoms must persist for more than 1 month and significantly impact daily life. So that's like the general overview. So any questions that you think the listeners would maybe have around that?
No, I think that was really well explained. I think that, I mean, I tracked that really well. So yeah, I think that was really well explained. Thank you.
Thank you. Yeah, and I probably explain it like 3 times a day. So so I kind of got that one down. So the key symptoms of PTSD, like I said, there's a very specific set of criteria and it is like 4 pages long in the DSM. So I'm not going to go through all of that rigmarole. That's too much. But just so people can kind of say, is this me? Is re-experiencing the actual or threatened event. So what that looks like is flashbacks, nightmares, intrusive thoughts about the trauma. Okay. So the next thing, and so that like nightmares is probably one of the biggest ones, and intrusive thoughts, I would say flashbacks less common, right? Which is where you have this sudden like memory of the event. That's like a flat, like you're back there. Nightmares, that's, when we're in REM sleep, that's how our brain sort of processes things that are going on. And so nightmares will occur. Intrusive thoughts is this constant thought that there's some kind of a threat, right? Which is leads into OCD and the anxiety disorders. So the next one is an avoidance of reminders of the event. So people, places, conversations, or feelings. That is a big one. That comes in with people who start using substances or start using other negative coping skills, is because they want to avoid the thoughts, the feelings of the event or events, right? Hyperarousal. So what that means in layman's terms is like feeling on edge, easily startled, difficulty sleeping, or being overly alert. So you'll see this in a lot of people, but I think it may be most able to be explained to people as when soldiers come back from a war, like war, right, overseas war, they can be very alert, like head on a swivel, right? Like that's something they were taught, but also to sort of manage their thoughts, manage that is like, I'm going to constantly like count how many people are in the room. I'm going to see where all the exits are, right? That we call hyperarousal or hypervigilance is what that looks like. Negative changes in thoughts or mood. So persistent negative beliefs, feelings of guilt or shame, emotional numbness, or difficulty feeling joy. So if we look at just these 4 things, we can pick out anxiety symptoms, depression symptoms, OCD symptoms, right? Like you can just hear it in a lot of these things that intertwines with trauma. So before I go into the actual criteria, so those are the things that people present with, right? That are going to come into my office and be like, here's what's going on in my life. I'm emotionally numb. I don't feel any joy. I'm always looking around to see what people are doing. I worry about what everybody thinks and if there's a threat there. Those are the kinds of things that make me think, okay, we need to ask more questions about is this possibly a PTSD diagnosis? So any questions about those things? So those are presenting symptoms. And then if there's no questions, I'll go into like the actual criteria.
Go into the criteria because I think that again was very well explained and I think that's very good. So
Okay. So the criteria that need to be met, and there's just 3 of them, and I think this is where people can get tripped up. So the symptoms must be directly tied to a traumatic event. And so let's take a look at the car accident example, because I think a lot of us have been in car accidents. So I think it's sort of an easy one to align with, right? Is that maybe you now can't drive on the highway, right? You have to take the side streets, and that's one of those avoidance things. So the symptom of not driving on the highway is tied directly to the traumatic event. Okay, so that's number one. Number two is the symptoms must cause distress or interfere with relationships, work, or daily life. So what that means is, we'll just say with the car accident, right? Is that maybe it takes you an extra 10 or 15 minutes to get to work because you have to take the side streets, or maybe you have to park all the way out in left field, right? And then walk to work. Like, again, very, very simple type examples. People come in much more complicated things. And the final one is the symptoms last for more than a month. Okay. So this is something that we were talking that I said earlier, right? So one of the things that there's a differentiation between PTSD and what we call adjustment disorder. So adjustment disorder is sort of like a bad thing happened, and then it's creating some of these symptoms, and then but they don't last more than a month. So a month or less. So you somehow resolve the trauma, however that happens, whether it's talking to people or having a therapy or whatever it is. Okay. So that's kind of the two parts that I'm looking for when, so the symptoms, and then that matches with the criteria. So they kind of go together. And then I can say, okay, let me ask some more questions. So already we've met the criteria for PTSD, and then I can ask more questions about this is a newer term, which is CPTSD, which stands for complex post-traumatic stress disorder. And the complex comes in when we're talking about, is this over a long period of time, right? Or is this multiple different traumas that happen in a shorter period of time? And so that's where the complexity comes in. There's no actual diagnosis for CPTSD in my DSM, but that is a term that has been largely and widely used within the therapeutic community to kind of be like, hey, this is a lot, right? So we're gonna give it an additional name so that we can know how to treat it appropriately.
Okay, so I have an example for you, a real life example that I would never have considered to be anywhere close to PTSD. I just called it anxiety. Okay, so several years ago, when I moved to where I live now, I was on the interstate and I was merging between a couple of interstates, and there was a semi, and he merged into my lane, and I was like, oh, thankfully there was nobody in the other lane, but then I thought my car was going to roll, and it was like a whole thing, and I had a huge panic attack around it, and this thing stopped driving on the interstate. I started taking surface roads. And now there are times when my husband drives on the interstate that I swear semis are just driving into us. And actually, it has kept me from. I had a huge panic attack down in your neck of the woods because I was driving to another friend of mine's house and I had to go through Kansas City, and I was by myself and I had to pull over, and it was like a whole thing. And I would have never, but as you were saying the criteria, I was like, well, actually, yeah, yeah, it does affect my daily life, because not daily per se, because I don't drive to and from work anymore. So that has helped. But anytime we're out and about, my husband weighs out the consequences of what am I, like, I do this deep breathing and I do, like, I have my tools and I do them, but he has to weigh out the consequences of, is it dark out? Because darkness, I have night blindness issues. So is it dark out? Is that going to make it harder for me? And should he take the interstate? Should he just take surface streets? Like, it's a whole thing that has affected now both of us, because I deal with this, and I would have never, ever, ever called that PTSD.
Right. I love your example, and it lines up with the things that I generally tell people if they're asking questions about PTSD. And I can't tell you how many people have come in and given me their history. And I'm like, sounds like there's some trauma there because the symptoms continue to linger, like your example, where we can't drive on the highway, where, nighttime, where you can't be hyper vigilant and you can't look around quite as much. So that's a perfect example of people who come in and they go, well, what do you mean it's trauma? And I'm like, no, like this is PTSD. And they're like, but I'm not a soldier. I haven't, had a major injury. I haven't had, anything. It simply is, if this thing is still causing distress in your daily life, that is likely, and if you meet the criteria, that is likely PTSD. And I would say this is why we added the C, is I would say there's a spectrum, right? So Jen, you can continue to live your everyday life
Yes.
with this situation,
Yes.
right? It affects you, affects your husband. Maybe it takes longer to get somewhere. It's not to the point where you can't leave your home or you can't be with friends or you can't, like, if you did work outside your home, that would be very difficult if you had to take a
Yes.
highway.
Yes, it was.
So yeah.
Yeah.
And so, right, like that's a really good, thanks for sharing that personal example about something that feels minor, that feels just like anxiety, but really is a trauma response.
And I've had people say to me, "Oh, you just need to get over that one. Like, it didn't really happen. You're fine." And I get it. I've said it to myself where I'm like, but there is something there that, and it's not every time. And we love, like, driving is our way of, like, we would prefer to drive anywhere to travel. So, we went on a big vacation this last summer and we drove. We drove to Utah. We drove down to Arizona. Like, they were 20-hour trips. And I've just learned that I have all these tools to use. And if it gets too much, sometimes I put my head back and I close my eyes. Sometimes that makes it worse because then I don't know what's going on. Like, so there is a thing. And I'm not saying like I walk around saying I have PTSD because I don't. I don't. I would have never even called it that until we started this conversation. But there is definitely something there. And I really just wanted to share it because I bet there's a lot of people listening that don't necessarily have the easy tools that I've even learned, like the breathing techniques, like the trying to focus on something else, just trying to get out of my own head around it and not spend all my time focused on it, especially when we're in the car. Like in the car, Dave and I play games. Like I'll pull out trivia games and ask him trivia questions, and that'll keep me from focusing on what's going on, and it makes the time pass so much faster for him. So, any of those things, if there's anybody listening that you're like, I need some simple tools, fantastic, reach out. We would both have tools to share and ways to do that. But I'm not saying I have this big horrible thing. It is definitely something that affects most of my life. And it's interesting because I'd never.
Yeah. Yeah. And like I said, there's a spectrum, right? So we've got things like this that sort of mildly affect our life, but they're an annoyance, right? Like it keeps you sometimes from doing the things that you want to do. To, like a severe response would be complete dissociation or inability to leave your home or inability to work, like not even be able to get up and do the things. So hopefully this was helpful for people to understand what PTSD is. And again, when I break down the words for people instead of the overall umbrella of what society thinks it is, it does make more sense. And this is where going to a therapist, going to a professional is probably it's going to be really helpful because as people, we like to be able to put a name to something that's going on with us that we don't understand. So I don't call it a label. I'm like, oh, now you've got PTSD and like this is your forever diagnosis. That's not true. So because if you work through the trauma with a professional, with other people, whatever it is, if you work through the trauma, then you no longer have those symptoms. And so you no longer meet the criteria for PTSD. So it's not a life sentence. It's not something, right, that you will never get over. Like people come in and they're like, oh my gosh, I just, vomited my whole story. And I know you think that I'm totally messed up and I have all this trauma. And they're like, oh my gosh, can you help me? And I'm like, absolutely. Like it might be a lot of work. It might be hard work, because we do have to kind of go back and talk about some of those things. And so it's hard. I'm really upfront with people when they have like a complex version of PTSD. I'm like, this is not an easy fix. Because people are like, how long is it going to take? And I'm like, up to you, up to your brain, right? How many tools are you going to use? How are you going to go out in your everyday life? Because even at most, like I'm generally getting people 1 hour a week, right? I mean, that would be the typical. So we're talking about you have another 6 days and 23 hours to use all the things that we've talked about. And if people aren't doing them, then the process is likely to take longer.
Yeah. I say the
So
same thing in coaching. Yeah. You have to do the work. If you're going to do the work, I'm only here to guide you and support you and love on you, but you have to do the work.
right. And I consider myself, I describe myself as a seed planter, right? So I plant the seeds with the information, like what does PTSD really mean? And your job is to water them, grow them, tend the weeds that will come in, and then you can have like a flourishing plant, right? And you can be healthy and you can do the things that you want to do. But my job is to just plant the seeds and then help you along your journey with maybe I'm having trouble watering. Why? Okay, well, let's try some other tools. I don't know how to pick the weeds. How do I deal with this or that? Okay, great. Let's talk about that. Let's talk about how they're affecting you. Let's talk about how we can either like use cognitive behavioral therapy, or which is great for trauma. Or another technique I use is called EMDR. It's eye movement desensitization reprocessing. And it's actually the number one modality technique that the VA now uses with veterans that have come back from, right, a severe situation, and they have these symptoms. So I have seen a lot of people get better from some pretty severe trauma with just using these two things. There are a ton of other ways to do it. These are just my specialties. They're the ones that I align with the most, that make the most sense to me. And so that's what I use with clients.
I love that. I actually have clients that see therapists that do EMDR and then they still come and they coach with me and it's a great complement. Like we work well together and do that for them. And so yeah, there's lots of ways that coaching and therapy just go hand in hand and they work really well together.
Yeah, I would agree.
Yeah, well, this was fantastic. Thank you for sharing all of your brilliance and your wisdom. I know I appreciate it and I learned a ton, and I hope you guys did as well. If there's anything that came up for you as listeners that you want more clarification on, or you want to talk about a specific subject, our email is always down in the show notes. Be sure you're checking that out and use that. That's private. It only goes to Kristen and I. We're the only two that know how to check it, and we won't ever hand that off to anyone else because that's a private thing, and we don't want anyone to feel scared about that or worried that other people are seeing things. So feel free to come in there and drop us a note and let us know if there are other topics you want to hear about that you want to talk about or bring into. Or another thought that I just had, and I'm going to say this, I guess I can edit it if we don't want it, is if you have something you want to come on and talk to us about and you're willing to share, that would be a really cool episode. Like, if you have something, let's talk about it. Let's do live therapy or coaching and let's work through. It'd be a really simplistic thing. It couldn't be like something that, takes months and whatnot, but it could just be something where you get a start to it. And let's do some live interaction. I know Kristen has to be careful with the therapy side. because she's only licensed in a couple of states. But we could both do coaching around it, and we could give simple tips and tricks and easy things like that could bring you through it. So think about that. If there's something you want, reach out to us. We're just glad that you're following us and that you're getting value out of these, hopefully. And we're just grateful that you're here with us.
Yeah, thank you so much. And Jen, I always appreciate your questions, and you can help me move it along and make sure that people are getting the information that they really need. So would love to hear from you, and we'll just talk to you next time.
All right, take care.
Thank you for being here with us today.
If today's episode hit home, don't just keep it to yourself. Subscribe, leave us a review, and share this episode with someone who needs to hear it. Because everyone deserves to know their worth.
Next week, we're diving even deeper with more insights and tools to help you break free from limitations and live authentically.
Until then, keep raising your standards, owning your worth, and embracing your value.